Hi, I'm gonna start this series about health. My topic for today is female pattern baldness. The female pattern baldness, or as some medical professionals try or like to call it, androgenic alopecia. It's a very common type of hair loss that affects women, usually around the age of menopause. Sometimes also affects women during teenage because some they think it's related to tri dihydro sorry dihydrotestosterone or testosterone. You could say the androgens. That's why it's called androgenic alopecia. But the good news is it's reversible. Not only you can stop it, but also you can reverse it. If, of course, you want to treat. If you don't want, some women they don't mind, that's totally fine. So I'm gonna tell you in this video the risk factors of the causes and then start off about talking about solutions. First thing you can do is taking vitamins or supplements for hair. Usually the hair products that have supplements have vitamins like A, B, C, D, E, zinc, iron, and biotin. But please consult a healthcare provider before using any supplement because not every one is, um, you know, can take the supplement. Some people can't use too much biotin, for example, so please consult a specialist before using them. Before continuing the solutions, I forgot to mention the risk factors. The main risk factor is a genetic. If you have a family member, not necessarily first relative, it could be your grandma, your aunt, so not necessarily your mom or dad. So usually you have to have a genetic factor in your family. Uh, Other thing is the age, as I mentioned, around menopause. And another thing is the stress. I think chronic stress can cause so many diseases. So uh, dealing with the stress is very important because psychologically, hair loss can cause stress and depression, and vice versa. Depression and stress can cause hair loss. So please take care of that. Cope with stress. Find some ways to deal with that. So, as a very natural way, you can use massage for the scalp, and uh, especially with certain oils like lavender oil, rosemary, castor oil, with massage the scalp. It helps relieving the stress. At the same time, these oils are beneficial to your scalp. I talked about hormones around menopause. There's a difference in the hormone levels. That's why some people relate this to androgens and testosterone, and that's why we see in teens around puberty that hormone is important for puberty. So, but sometimes when it's in excess, it can cause polycystic ovary syndrome and it can cause hair loss. So, if you are teens, you can consult your doctor to take certain hormones. But if you are around menopause as well, you have to check your hormone level if you would like to do or search about it. But in my video, I'm gonna give you the thing that you can do by yourself over the counter. You have to take care of your diet. If you are vegetarian or vegan, you can take 40 to 60 gram of proteins. I recommend the Mediterranean diet because it includes fruits, vegetables, protein that can minimize hair loss. Um, if you are vegan, you can maybe use tofu, any, just the right amount of protein. Now I'm gonna tell you the most important thing in this video, which you can see in the picture, is minoxidil. Minoxidil 5% is the main thing that I recommend. You can buy it over the counter. I will put two links down below the video. This one is Kirkland brand. It's available in the States, I think. So I'll put the link for you. But if you are in Canada right now, this bottle is not available. So I will put the other link, which is Rogaine, is the brand name for it. But it's the same. It's minoxidil 5%, which helped in 60% of patients, according to trials and research. So this, you can have really good results with minoxidil. But the trick here is you have to continue using minoxidil. It's not something that just one time, that's it. You have to keep applying that to your scalp. It's a topical, sorry, I forgot to mention, it's a topical solution that you can use as a dropper on your scalp with massage the area and continue using it. So this is the main thing I recommend. The other medication is finasteride. Finasteride is by the brand name Propecia. Also treat female pattern baldness, although it was used for men, but nowadays doctors prescribe it for female baldness and hair loss. So please consult your healthcare provider uh, because it's a prescription medication. The third thing is shampoo called ketoconazole 2%, which some people can use it along with the finasteride. They can see good results. Another important thing is you have to pay attention to the things that you are using on your hair. If you are using shampoos, conditioners, please use the paraben-free, sulfate-free, because all those chemicals can play a big role in the hair loss and increase it. So please try to use as much natural things as you can. Another note as well is the hair dyes. If you can, try hair dyes that are natural, ammonia free, as much as you can. Anything that you put on your hair play a big role. So try to use natural things as much as you can. In clinic, you can do something called plasma injection by a healthcare provider or microneedling. Um, Another thing is red light therapy, of course, by a healthcare provider as well. Um, it treats the scalp with a low wavelength red light to improve hair growth. It's kind of uh, laser. Both the plasma injection and the red light therapy have parallel results to minoxidil, almost same results. So you have to follow up, not only doing it one time. You have to follow up with these same as minoxidil. So in my opinion, I recommend minoxidil more. But if you are willing to do, you know, more than one thing, it you can do that. It helps having better results combined. um, but as I mentioned, minoxidil by itself improved the hair loss in 60% of patients. Another thing is the styling technique. You may hide your um, uh, pattern of baldness by certain hairstyles, wigs, or hair weaves, um, or hairstyles even. I forgot to mention the pattern itself. It starts in stages. The first stage is little or no hair loss, then slight gap appears in the center of the hairline. Sometimes some women have wider gap, and it starts to be on either sides of the head, and some of the women have on both sides. Um, so not only in the front of your hairline. So the advanced stage is when you have more than one spot. So uh, last I would say last resort is hair transplant, of course by a healthcare specialist. um, this is the last resort. It's expensive and you have to be careful. uh, you have to trust the person you are dealing with, so you have to, you know, well-known provider. uh, I hope you liked my video, and I'm willing to do more videos like that for minor illnesses. I hope you like my topic for today. Thank you, and please click on the links down below if you are interested to buy the minoxidil, and um subscribe, share, and like my video. Thank you.